Good evening, everyone, and welcome to Holistic Motion EP. My name is Lewis, and today I'll be presenting to you our new patient, Frank. Frank is a 68-year-old male who has been diagnosed with stage 3 hypertension 2 years ago. His GP has been working with him to help lower and stabilize his blood pressure via medication, in particularly Twinster 85, which has worked well for him. His GP has now referred him onto our services to continue his care via lifestyle modifications and exercise as another intervention to maintain and improve his health. Frank's main goal is to be able to exercise safely with hypertension, improve his cardiorespiratory fitness, and muscle strength. So let's get to know Frank further. So, have you met Frank? As you can see, there is more to Frank than just his clinical presentation, and we want to be taking consideration of all other aspects of his life. This will allow us to empathize and understand him better and give us more opportunity to help him reach his goals. So let's break it down. Clinical presentation shows that he is definitely stage 3 hypertensive with his systolic and diastolic blood pressure at 175/83. Although we don't know the etiology of his hypertension, we can see there are other factors that could be contributing to this. One, his BMI is currently 34.7, which categorizes him as obese. Two, his waist to hip ratio is at 0.98, which places him in the moderate risk category. Three, as a full-time architect, he says he's sedentary for most of the day. And lastly, he has had a history with depression, which may cause some stress. All of these definitely have an impact on his blood pressure, but the good thing is they are all modifiable, and this is where we come in. Other aspects of Frank's life that we want to take into consideration before planning an intervention is his psychosocial health. He has mentioned that he thrives off of his family and social life, and he occasionally enjoys cycling. So we definitely want to be integrating some of this into this plan for enjoyment and adherence. Moving on to understanding his condition. Although there are many factors that can contribute to elevated blood pressure, such as genetics, lifestyle, it all comes down to two main mechanisms. One, vasoconstriction of blood vessels, which reduces the lumen diameter, which restricts the rate of blood flow and increases resistance. And there are two main pathways for this to occur. One is via the sympathetic nervous system, and two is via the RAS system, which produces angiotensin II, which is a vasoconstrictor. And number two to contribute to hypertension is increase in blood volume or platelet count, which is controlled by the renal system. The issue we have with prolonged hypertension is that it places extensive stress on the whole system. One, more pressure on the arterial walls, which can cause damage and make them more prone to plaque buildup, which leads to restricted flow and potential blockages. Two, it forces the heart to work harder to counter the resistance. This can lead to hypertrophy of the heart muscle, which results in reduced efficiency and potential heart failure. And three, prolonged pulmonary hypertension can cause right-sided heart hypertrophy to compensate for the restricted blood flow, which can lead to heart failure. Although we don't know the exact cause behind this elevated blood pressure, we have spoken about the modifiable risk factors that could contribute to his condition, and these are the components we will be focusing on to improve Frank's health. So, what can we do and what are Frank's goals? Although we didn't get to delve deeper into Frank's goals and define his SMART goals or perform any baseline exercise testing, we were able to come up with these short and long-term goals. The early phase of his program will predominantly be focused around introducing him to structured resistance and aerobic training, as this directly relates to his goal of improving muscle strength and cardiorespiratory fitness. The second goal we'll be focusing on is building a consistent habit with training and extra activities outside of the gym or non-exercise activity thermogenesis. This could be going for a hike with his, This could be going for a bike ride with his friends and family, taking the stairs opposed to the lift, or extra gardening around the home. Lastly, we want to aim to start reducing his BMI score as this will directly correlate to improving his health. For his long-term goals, we aim to reduce his systolic blood pressure by 5 millimeters of mercury or more, as this significantly reduces his risk of all-cause mortality and death due to stroke and coronary heart disease. Furthermore, we aim to reduce his body weight by 33 kilos and his waist circumference by 3 centimeters, as both of these goals will place him into a much healthier category and reduce his risk of other cardiopulmonary issues. Lastly, moving on to his program. So in regards to Frank's training program, we focus on placing his goals of exercising safely while training with hypertension, improving cardiorespiratory fitness, muscle strength, and improving his blood pressure by prescribing exercises, intensities, and progressions that would suit his capacity and ability. We did not have any set days as we want to give Frank some autonomy around his training structure. In the first week of his program, we followed the literature and guidelines and prescribed him with 1. A 3-day program, 2. Combined resistance and aerobic training, as Olsen stated that this had more benefit to reducing blood pressure than just training one modality a day. 3. Resistance training on 2 or more days to improve his strength. 4. Isometric resistance training following the protocol stated by Inder and Edwards of 4 lots of 2 minutes on, 2 minutes rest at 30% maximum voluntary contraction 3 times a week, as this results in a significant reduction in blood pressure. Where we deviated away from the literature were 1. Training frequency was lower than suggested, as Frank is very new to the gym and we don't want to overwhelm him, as our main focus for him is enjoyment and adherence. 2. We didn't prescribe one set of 8 to 10 exercises for resistance training as suggested, as we believe having to learn more exercises could create more resistance to adherence. Instead, we chose 4 exercises to be repeated twice, as this gave Frank more repetition and potential progress with the new exercises. Lastly, although Frank enjoyed cycling, we alternated his aerobic modality to keep him interested, but also reduce his risk of overuse injury, which was stated by Lee J. In the 8th week, we followed much of the same protocols with the additions to progress Frank. So what we did was, 1, we added high-intensity interval training. As Edwards stated, it significantly lowered blood pressure and had greater physiological benefits than moderate-intensity continuous training. 2, an addition of another training day to increase training frequency. And 3, an addition of sets for his resistance training to progress his training volume. So to wrap it up, we would be monitoring his blood pressure and RPE during his first few training sessions to make sure he was comfortable with the exercises and the intensities. We would then check in with him regularly to see how he's progressing along and make adjustments if needed.